By proceeding, you, the viewer, have read and agree to the following disclaimer. Hi, I'm Dr. Jill Crista with more in my series, Infection-Induced Encephalitis. This first webinar series is covering all the fundamental support that you need to do in conjunction with conventional care for your PANDAS, PANS, and autoimmune encephalitis kid. Coming to you as a licensed naturopathic doctor and a fellow PANDAS PAN mom, I want to share with you the things in this third section on how to support the brain and how to reduce dopamine and all of the things that are increasing inflammation and making your kids suffer more. This is to be used in conjunction with your conventional care. Hope you find it helpful. Brain. All right, keep it moving. We're going to talk about EFAs, essential fatty acids, glutathione, calming the excitatory state. A lot of kids with PANDAS, Sydenham's chorea, Tourette's are working on a high dopamine or dysregulated dopamine. And then body-brain, some of the little things that we've used in our family and with my patients that have been amazing for just getting a little bit of calming and helping the brain drain. Now remember, brains drain when you sleep. 90% of the brain draining and cleanup happens during sleep. So in my next class where we talk about special topics, I really hammer on sleep because it's such an important piece to keeping the brain healthy. Okay, essential fatty acids, that means DHA, EPA, and GLA. I put DHA first because there are so many studies on DHA and neuroinflammation. That means inflammation inside the brain. We know specifically DHA reduces antigen-specific T cell proliferation. So at Columbia University, they're seeing that Th17 is definitely involved in the PANDAS situation, but possibly also Th1. And so DHA helps to reduce those cells from going wild. Basically, they can't divide and go crazy. And then there are some brain autoantibodies that have been seen in other conditions that DHA prevents from forming. So you might have that strep trigger, but if you have a DHA-rich brain, it doesn't have to create a PANDAS-type autoimmune response. Food intake is not enough to handle for these kids. These are special kids who they're already in an immune response, so you have to dose really high in the beginning to get on top of it. And then again, you may need an emulsified form from just a absorption issue. I personally pulse this one with phosphatidylcholine because my kids have methylation issues, and I see a lot of kids in practice that do. So phosphatidylcholine, we want to make sure that we're not over-absorbing the EFAs and reducing your phosphatidylcholine balance. So I'll throw a phosphatidylcholine in 2 to 3 days a week. Glutathione, my favorite brain antioxidant. This baby, there are lots of supplements that help stimulate glutathione, but why not just go for the thing we're trying to get at? Just go right to the end game. And glutathione is really important for reducing neuroinflammation. It reduces infection-related oxidative stress to the thalamus, which we know is an area of involvement with PANDAS and PANS. And then a depletion is associated with microglia activation. That's the immune system of the brain. And that is a system that is activated in autoimmune encephalitis. The depletion is also associated with dopaminergic dysfunction, which means the dopamine is just dysregulated. There's too much, it's not stimulating the receptors because the receptors are under attack. So the whole dopamine system is out of whack. And glutathione depletion is related to this. So it stands to reason that glutathione supplementation and repletion helps to reduce this. I like to use the liposomal oral. It tastes terrible. It tastes like liquid farts, as my kids describe it. But it is so important. It's one that I do bribing to get this one down. You can also nebulize it in an asthma kind of a mask, or you can use IV if you have that option available. So it's, a pick your battles kind of thing with glutathione. So the controlling the excitatory override is we're trying to control or re-regulate dopamine and glutamate. So I put some things on this slide. These are, for me, aces in the hole to have in your pocket, especially with these kids that have this dopaminergic dysregulation. B6, when you have excess dopamine, gets depleted, and that can further fuel more dysregulation. So I'm a big fan of B6. I typically use anywhere between 100 and 250 milligrams with my kids. 5-HTP can be used as a serotonergic or serotonin booster. And then Bacopa is, this one you need to really know about. It's an anti-anxiety or anxiolytic. It's an antidepressant. It re-regulates dopamine, GABA, and serotonin, which is really amazing. It pushes, dopamine can either be excitatory or inhibitory depending on the soup it's swimming in. So if it's inflammatory soup, it's going to be excitatory and it's going to cause more problems with tics and ADHD and things like that. If it's swimming in a soup of serotonin and GABA, things will be more, it'll go more toward the inhibitory side. So Bacopa restores that balance and also restores the receptor function of the dopamine 1 and dopamine 2 receptors, which are damaged in pandas. It also increases superoxide dismutase, which boosts glutathione intrinsically in the brain. So there's another one that you can take the glutathione, but you also can add the Bacopa and push that glutathione level so that the brain is under an antioxidant state instead of an inflammatory state. I want you to know also about Magnolia. There is a study there I put that at the bottom. There's an antidepressant effect via LPS blockage, and one of the things that I learned at this conference was that LPS is a really important lipopolysaccharide, is an important piece to the whole inflammatory cascade when it comes to Sydenham's chorea, which has a lot of likeness to pandas. And then I recommend that you avoid turmeric or curcuma. There are a lot of well-meaning doctors out there saying, oh, it's a great neuroinflammatory agent and it helps detox the liver, but it also can stimulate dopamine. And then I would avoid glutamine, which is also used, and us well-meaning doctors trying to give, I did it to my own kids. I gave them glutamine to try to build up their gut barrier, to build up their brain barrier, and you can actually cause an increase in glutamate, excitatory neurotransmitters with glutamine. So find other ways to get that gut healing through food and through like butyrate and other things like that helps the gut with its healing. Bodywork, I want you to know about craniosacral therapy. You'll want someone trained by the Upledger Institute. It is phenomenal for restoring the basic pulse of the brain. We have a pulse of our breathing, we have a pulse of our heart, and it turns out that the cerebral spinal fluid has a pulse as well. And in anyone with an autoimmune encephalitic syndrome needs this therapy to reset it. And it's something that can be given, it's very, very safe. They lay on a table, it's very easy, and needs to be done frequently to keep things on track. And then good old acupuncture. Lots of studies about acupuncture and pain, and I think there are more and more studies now with autoimmunity and immune function.